Hey y'all, my name is Yevon Rowe. I'm a first year medical student at UMass and the third place winner of the Berlin Creative Writing Award. I wanted to give you a video of my piece because it's done in a style of poetry called spoken word or slam, and it's meant to be heard, spoken out loud. And in the spirit of that style, I want to give you a few shout outs and thanks to the people that made it possible. First of all, big ups to my lab group. That's John Gamble, Matt Carroll, Steph Luddy, and Emily Ziadi. Thank you so much. And also a big thank you to the MVP at our lab table, who is our Cadaver, the generous woman who donated her body to science. We can't show our appreciation enough. I want to give a special thanks to Dr. Nealon, to Dr. Berlin, and a big thank you to all of our DSF professors, and in particular Professor Gilroy, Dr. Gianaris, and Dr. Kotanch. Thank you so much for making learning come alive. So without any further ado, to the Cadaver at Anatomy Table 12. The number one rule at Anatomy Table 12 is respect the cadaver. Because on the day we first met, our professor told my entire class of MS1s to respect the cadavers, to respect you. But she never told me how. Doing so with patients who are alive is easy. Wash your hands, introduce yourself, don't pass judgment. Basic things I should know, things the admissions committee believed I could do. But there is never enough surface area at the lab bench when insides start becoming outsides, tops of skulls being turned into dishes, holding scraps of skin and fat in the effort to expose more muscle, rib cages reflected to create large, gently curved plates, creating a makeshift tray for tools. Still, I am uncertain if this was disrespect, but certain that this was not respect. Each time, I slid on a pair of nitrile gloves. I wasn't sure how I was going to respect you, so I treated you as if you were still alive. I gave you a smile when we first made eye contact, despite the clouded eyes and the plastic bag covering your head, as if you could still see me. When my lab partners took the shears to your ribs to reveal your heart, I abducted your arm and patted your hand, as if I could soothe your pain, as if you still had any concept of pain. And when I slid our scalpel too suddenly through your skin, I said sorry, seeing as I had sliced your small saphenous vein, as if you could still hear me. I keep forgetting that you are not alive. To say dead doesn't seem quite right, regardless of its medical accuracy. The starkest reminder is not your eviscerated body, nor the black plastic bags filled with your organs, but the pink polish on your nails. Your body has been cold for 2 years, but that polish still shines. Its flecks of glitter still sparkle like you've reapplied it when the lab lights go out. But I catch myself. The polish still looks fresh because your nails stopped growing. Stopped growing 2 years ago when your overloaded heart failed to beat. How could I forget? In my efforts to respect you, I had forgotten that you were resting in peace. I only felt privileged to have such a compliant patient, one who could forgive my many mistakes and trust in my mere bachelor's degree. Perhaps I grew too close. In striving to respect you, I created a caricature of who you might be. Our lab manual said to feel the space between the heart and pericardium, to appreciate it. It never said how, so I slipped my hands around your heart, a still drum, wondering if I would feel the boot prints of past lovers, if I would feel the bits of warmth planted by the kind words of a stranger. I pulled on the tendons of your forearm, watched the fingers curl. I deviated from the lab manual again as I began wondering, how many hands had you held? Did you prefer to shake hands firmly or hug closely? When I cut your cranial nerves, I peeked at them, hoping to see memories leaking from their severed ends. My eyes tried to distill the drops of clear fluid into stories. Maybe they could filter the fluid, and I'd be able to observe in the drops from CN2 the last images you had seen, catching glimpses of your life flashing before your eyes. Maybe your final thoughts had coagulated in your brain. I needed only to pierce the pia mater to see them ooze out. I hoped memories were still stuck in your neurons for me to explore, but there was only the steady drip of embalming and cerebrospinal fluid, steady like clockwork, counting down the moments till I too would need to decide if I would donate my body to science. Alas, you kept your stories and your secrets to yourself. Your winged scapula was a mystery, to which our professor tried to explain by asking, did she have a mastectomy? Not until a few months ago, when we dissected her breasts in Lab 1, I wanted to say. But I stayed as silent as you, and I wondered if I too would soon become forgetful of my patients. I cannot forget you. The black ink of permanent marker on your patient history could not drown out your name. It could barely make you anonymous, and I would call you by it. But it feels unceremonious to say your name without ever being formally introduced to you, without even sharing a handshake and a smile. It feels ignoble to respect you clumsily, grasping at fibers of courtesy, to weave some form of deference, hoping it matches the color of your character, without ever knowing you and how you wanted to be respected. Thank you very much.